And in the studio with me, Dr. David Hogberg, healthcare policy analyst with the National Center for Public Policy Research, conservative think tank here in Washington, D.C. Nationalcenter.org is the website. David, nice to see you.
Nice to be here.
Thanks for joining us.
Sure.
You wrote a rather detailed, I think, and this is at nationalcenter.org, analysis of, well, why don't you lay out your argument rather than my trying to characterize it?
Sure. What I was looking at was the quality of health insurance in the individual market in 2013 before the exchanges, and compared to the quality of health insurance on the Obamacare exchanges now. You might recall last year when millions of people were losing their or receiving cancellation notices for their insurance that they had. A lot of the Obamacare supporters excused it by saying that the insurance they had was poor quality. President Obama himself called it substandard. Ed Schultz on MSNBC referred to it as crappy, as he said, and he only referred to it that way because you couldn't use the S word on TV.
Right.
And well, I decided let's take a look at that. And what I did is I looked at the insurance markets in 10 large cities. Compared the insurance available for a 27-year-old single person and a 57-year-old couple, and I looked at two important dimensions of quality for health insurance: out-of-pocket costs and the things like the deductible and out-of-pocket maximums, and the provider networks, the networks of doctors, hospitals, and others that are covered by a plan. And basically what I found is that overall the quality on the individual market was better than what's on the Obamacare exchanges. There were about 33 plans on average for a 27-year-old single person that had both lower premiums and lower out-of-pocket costs, lower cost sharing, than what's available on the Obamacare exchanges now.
So why, if we have a competitive marketplace, I mean, even within Obamacare, it's still a competitive marketplace to some extent. Why is that?
Because the government has interfered with competition.
So in bending the cost curve, Obamacare is also bending the competitive curve, you're saying?
Well, I don't know if it's bent the cost curve, but that's a different issue. What it is bending, it is bending the competitive curve. It is standardized plans so that,
right. Some of them are going to be lowest common denominator. They're not going to be
10 various benefits have to be covered. You also have community rating and guaranteed issue. Those are all costly things to cover, and the only way the insurers could keep the premiums even remotely reasonable was to cut back on cost sharing. That is, that the cost sharing is larger than it was.
Cost sharing being your deductibles,
yeah,
right.
and
so basically
cutting
what you're
back
saying,
on the provider networks.
Right. So what you're saying basically is if people want to have those 10 things, and you listed them in here someplace. Essential benefits: ambulatory patient service, emergency services, hospitalization, maternity, newborn care, mental health, substance use disorder, prescription drugs, rehabilitative services, lab services, and preventative and pediatric services. If people want to have that, they're going to have to pay for it. I would argue that, and you have some anecdotes in here that are interesting. Making an argument by anecdote is always risky, but
well, I wasn't making an argument by anecdote. I was just trying to use an example, a real life example of the overall point.
I would argue that perhaps you're right. I'll give you that. In fact, in all probability, you're right. What this does is it points out the weakness of a for-profit system, and trying to turn public policy in the frame of a for-profit system, in my opinion, is a big mistake. We're seeing the same thing in our private prisons. There are for-profit systems have incentives built into them that don't necessarily comport with the public good. So I agree. Obamacare should, it's not a perfect system. It's not even necessarily the very best system or even close to it, because we're still handing billions of dollars in profits off to private for-profit entities. But beyond that, I think that the argument that you're making is in a way the argument that people make when they say I should be able to ride my motorcycle without wearing a helmet, or I should be able to drive my car without wearing my seatbelt. If the public good is enhanced by everybody being insured, and in this age of Ebola and the possibility of deadly flu viruses and God only knows what else, public good really, the public health really becomes an important thing beyond just, hey, is he even insured when he's coughing in my face? Right? Does he have access to a doctor? In that world, I would say that anything that moves us toward greater participation is working in the public good. And if there's people get what they used to get, which they thought was cool.
What is the public good?
Well, the public health. It is less cost. It's far less ER with, as we've actually had stories of, breast cancer breaking through the skin because they've just been ignoring that lump, thinking it was an infection for a year now. Now it's not only is it metastasized. I mean, when that person shows up in the ER, than if they had free annual checkups, which is going to, change the deductible, those cost structures, and they don't die of cancer, and they stay in the workforce, and they stay productive. And it's even more.
Let's unpack a couple of things you said there. I think what you were talking about, in part, is the coverage for preventive care, correct?
Well, no, I'm saying even having access to care is in and of itself preventative.
Well, that can certainly be true, but I'm not sure that the public good, public health, is best served with more government intervention. I think it's...
But if government insured people from 50 or 60 million down to 10 or 20 million, how is that not a good thing?
Well, first of all, it's not clear that that's what happened.
No, because you got a bunch of Republican governors saying, we're not going to play.
No. Yeah, Obamacare itself may have resulted in, the exchanges have resulted in over 1 million more uninsured. That was the uninsured rate right now. The current population survey recently, showed that there was a drop in private
the uninsured rate has dropped to the lowest level.
That's from the CDC survey, but not from the Census Bureau survey. The Census Bureau survey.
The last census was 2010, before Obamacare.
No, the Census Bureau covers health insurance and things of that stuff. Polls for that every single year.
This is the CDC says.
The public good, if we're going to talk the public good, is best served by markets, which is what drives down costs.
No, that's our fundamental disagreement.
I know, and you're wrong. Markets are what drives down costs and increases quality, not government.
If you have, quote, free markets, you can make that argument in the abstract, but there is no such thing. Where do you have a free market? In the United States?
All over the place.
No, you don't.
Yes, you do. Being a free market is a matter of degrees. It's not either or.
Right, there's no such thing as a free market. The closest you have to a free market...
I mean, come on, Tom. There's no such thing as socialism either, but it's a matter of degrees. And the freer a market is, the more it's going to reduce costs and improve quality. And we have not had anything close to a free market in healthcare for a very long time. We have had over the last couple of decades, we have constantly increased government's involvement in healthcare, and that's why costs have continued to go up. That's why it's harder to insure more of the population. And Obamacare does nothing but continue that.
When Reagan came into office, in most states, most hospitals had to be not-for-profit. Most insurance companies had to be not-for-profit. I was running a company in 1978 with 18 employees. We were paying $35 a month for comprehensive Blue Cross Blue Shield with no deductibles for entire families. I mean, because in Michigan, Blue Cross Blue Shield had to be not-for-profit. The hospitals had to be not-for-profit. Reagan blew all that up, and we have seen... Bill Frist's family made $3 billion. Rick Scott down in Florida made billions, hundreds of millions of dollars. All this profit has been coming out of that. That's not a free market. Or arguably it is, but it doesn't serve the public.
No, I would agree that a lot of that is not a free market, but the general trend has been more and more government involvement in healthcare. Even things like...
David, you get the last word.
Sure, even things like COBRA regulation happen during
the Thom Hartmann Program.
15 minutes past the hour. David Hogberg, nationalcenter.org, right?
That's correct.
There you go. Thank you, David. Great to see you. We'll be back.